This slideshow is on fungal diseases, and it's on common diseases that are caused by fungus. The slideshow takes approximately 12 minutes to watch. An important issue about fungi is they're everywhere. They're within our homes and they're outside our homes, and there's actually over 1 million species of fungi. However, very few of them cause illness. They're easily spread also because they can be found in soil or on plants, and sometimes they're inside or on human skin. So they're relatively easy to spread. So we're going to look at a few of the fungal infections that might be read about in literature more often than others. And these include aspergillosis, blastomycosis, yeast infections, fungal eye infections, histoplasmosis, pneumocystis pneumonia, ringworm, and what's commonly known as valley fever. So the first one to look at is aspergillosis. And as we're going through the slides, each slide will have a photograph of what the fungus looks like under a microscope. So aspergillosis is caused by an aspergillus mold that you can find inside and outside of your house. Most people are not going to get this disease. However, if someone has a weakened immune system or lung disease like cystic fibrosis, or the person has asthma, then that person is more likely to come down with this fungal infection. Because it's a respiratory infection, the signs and symptoms are almost always respiratory. However, if the disease spreads throughout the body, then the person may get a fever because the disease or the fungal infection has become generalized. In order to diagnose this disease or infection, the doctor or nurse practitioner will look at the symptoms, they'll do a physical exam, sometimes an x-ray or CAT scan of the lungs are taken, and blood tests can be taken to see if it's spread throughout the whole body. The treatment includes antifungal medications and steroids. Prevention of this disease is difficult because it's found everywhere. However, people are at high risk, should avoid dusty areas, and if they're going to be in dusty areas or work with soil, they need to make sure they have an N95 respirator, and they always need to make sure that they're wearing gloves while they're gardening. The next fungal infection is blastomycosis, and anyone is at risk for this fungal infection. However, people with diabetes or a weakened immune system are at much greater risk. Only 1/2 of the people who become infected get signs or symptoms, and these symptoms may appear between 3 and 15 weeks after the initial exposure. This is caused by a specific fungus that's found in soil and decaying organic matter. The signs and symptoms include flu symptoms like fever, chill, and cough. In order to be diagnosed with this fungal infection, a culture is taken and microscopic exam of tissues is completed, and there may be an antigen test to see if the antigens are present in the body. The treatment is antifungal medication, and since only half the people get the symptoms, sometimes the symptoms are treated, sometimes they're not, but they're usually treated with antifungal medication. And to prevent this fungal infection, people should avoid wooded areas and places where organic decomposition is occurring. The next set of diseases we're going to review is the fungus disease known as yeast infections. And yeast infections occur in 2 major ways. The first is oral or thrush, and the second is vaginal or yeast infections. People at risk for thrush or the oral type of fungus infection are people who are immunocompromised, have diabetes, are using cortisone, or have recent organ transplants. Most of the immunocompromised people would fall into categories of chemotherapy, or perhaps they have HIV infection. Vaginal and yeast infections occur more often when women are pregnant because the hormones vary, if they have diabetes, if they're using broad spectrum antibiotics or cortisone. So the signs and symptoms of oral fungus infection or thrush include a sore throat, redness in the throat, difficulty swallowing, or cracks in the corner of the mouth. In genital yeast infection, the person who's infected might have itching or burning, and they'll have a cottage cheese-like discharge. Diagnosis of oral thrush is through microscopic examination of a sample from the throat. And for vaginal or penile fungus infection, again, microscopic exam of the sample of the discharge from the infected area. Treatment is typically suppositories or oral prescriptions. For oral, it's prescription taken by mouth. For genital, it's usually suppositories. However, sometimes they prescribe pills for if it's a recurrent yeast infection. And again, these are all antifungal medications. Preventions for oral: if you are at risk, you should be using mouthwash of a certain type. For example, people who are on chemotherapy are almost always given this mouthwash to help prevent thrush from developing. And for genital yeast infections, wearing cotton underwear, taking oral probiotics like yogurt every day will help prevent recurrent infections. The next item is a fungal eye infection, or something called fungal keratitis. It's very rare, however, it's also very serious. People at risk for this fungal infections are people who may have had an eye injury with a plant through thorns or a stick. They may have had recent eye surgery. They might have an eye disease. Their contact lenses could be contaminated. Medical products could be contaminated, or it could be in the bloodstream. The signs and symptoms are typically redness of the eye and blurred vision, sensitivity to light, tearing, and discharge. This is determined by an exam of the eye or microscopic exam of the tissue or liquid discharge of the eye. Typically, people receive eye drops. Sometimes they receive pills, IV medication, or surgery in order to correct the problem. The best way to prevent fungal keratitis is to wear protective eyewear when you're working. Always have on glasses to prevent injuries, and make sure the contact lenses are cleaned correctly. The next type of fungal infection we're going to review is histoplasmosis. And histoplasmosis lives in soil, and some of the more common areas where you find histoplasmosis are Central and South America, Africa, Asia, and Australia. And it's found most often in soil where there's a lot of bird or bat droppings. People who are at risk are people who deal with soil that may have bird or bat droppings, people who are immunocompromised, people who have had an organ transplant, are taking cortisones, infants, people over 55, or someone who has traveled to one of the places that I just mentioned that have higher amounts of histoplasmosis. Signs and symptoms: most people have no symptoms, but when there are symptoms, they're typically flu-like symptoms. And if someone's immunocompromised, it can lead to a long-term severe lung infection and can actually spread to the central nervous system. The diagnosis for this disease is a medical exam and a travel history. So your healthcare provider will ask where you've been, and if you've been to Central or South America, Africa, Asia, or Australia, then you are at higher risk, and at that point they may do x-rays or CT scans of the lungs to see if it's present. Treatment for some people goes away with no meds, but others need oral antifungal medications. Prevention: the best way to prevent this is to make sure you avoid soil that might have bird or bat droppings. Don't clean chicken coops, avoid caves, and avoid working in the demolition or remodeling of older buildings. The next fungal disease we're going to review is pneumocystis pneumonia, PCP. And most people at risk for this are people with AIDS or HIV infection, other people who are immunosuppressed or in immunosuppressive therapy, if someone has connective tissue disease or chronic lung disease. This is a very rare form of pneumonia because it's caused by a fungus. The signs and symptoms include a dry cough, shortness of breath, and fatigue. People are typically diagnosed with this through microscopic examination of fluid that they're coughing or lung tissue that goes under an examination. The treatment is to take these drugs orally, and these are the list of drugs that often are taken. Bactrim, Septra, Cotrim, they're taken orally or through IV to help clear up this PCP. And prevention is some people, if they're at high risk, will actually take those drugs prophylactically to prevent from getting the disease. The next one is ringworm, which is called Tinea corpus, and it's caused by a variety of fungi. An interesting thing about ringworm is you're noticing we are going over this when we're talking about fungus and not parasites. Ringworm is not a worm, it is a fungus. Everyone is at risk for getting ringworm. It's a very common infection. However, it's most common in people with weakened immune systems. It's easily spread in public showers and restrooms. It's easily spread with athletes in contact sports like wrestling. So anytime someone is in any of those situations, they're going to be at higher risk. The signs and symptoms are the itchy skin, and there's a ring-shaped rash and hair loss. So if you look at the two photographs on the slide, both of those are samples of what ringworm looks like when someone has it. Typically, it's diagnosed by a simple visual examination of the area. And for some people, treatment can include over-the-counter drugs, but sometimes antifungal medications are needed. The best way to prevent this is to keep the skin dry, make sure shoes circulate air. Don't go barefoot, especially in places where other people work. For example, if you are in a place where there's shared shower spaces, then you should wear flip-flops when you go in. Keep the nails clean and keep your nails clipped short. Make sure you change socks and underwear routinely. Don't share intimate objects like towels, and make sure you shower immediately following sports. So this is a condition that's spread very easily, but it's not hard to get rid of, but it is uncomfortable. And the last fungal infection we're going to review today is what's known as valley fever. And if you look at the bottom of the slide, it tells you where valley fever fungi can be found. So these are specific areas where we know that if someone goes, they're more likely to be at risk for developing valley fever. So valley fever, the fungus lives in soil in certain areas, and you can see where it is. It's disturbed by farming or construction or wind, and when it's disturbed, people can breathe in or inhale the spores. The signs and symptoms, there's a fever, there's respiratory symptoms, chills, night sweats, headache, fatigue, red spotty rash, joint pain. There are a variety of symptoms of valley fever. So the diagnosis will include a chest x-ray or blood test that show antibodies that have been developed to this fungus. The other item that would be done would be a history of where you've traveled to see if you've been in any of the areas where this fungus is more prevalent. The treatment, it usually goes away without any treatment, but if someone has a weakened immune system, they're going to need antifungal medications to be able to battle the fungus. And sometimes a portion of the lung is removed if it gets very severe. The prevention is to avoid travel to locations where it's found or prevalent. And if you do go to those locations, just be aware that if any of the issues occur like farming, construction, or wind, that you are at an increased risk for this disease. So here is a summary of the fungi. Many of them are found in soil. Often they cause no health problems whatsoever to the human host. If someone is immunosuppressed, it allows the fungus to get much worse. They're easily curable unless the person has a suppressed immune system. They're found everywhere in our world and in our society, and even though there's over 1 million known species, very few of them cause illness. So that concludes this lecture, and at this point you would be prepared to complete all your online assignments and take the quizzes so you're ready for your test.